Episode 4, Georgia pharmacists could soon be filling prescriptions for medical marijuana. The Drug Enforcement Agency starting the process of reclassifying marijuana as a lower risk drug. Channel 2's Tom Regan spoke with some folks on both sides of this one.
The idea of picking up a prescription for medical marijuana at your local pharmacy may seem a little far-fetched, but that could be inching closer to reality as the federal government considers a major policy change on how it views and regulates marijuana.
Pharmacist Ira Katz is a strong supporter of medical marijuana. He had planned to fill prescriptions after Georgia approved medical cannabis and allowed independent pharmacists to dispense it. But that never happened after the DEA threatened criminal prosecution.
We were the only state in the United States to have pharmacists to be able to dispense medical cannabis.
But now that could happen. The DEA is in the process of downgrading the classification of marijuana from a Schedule I drug, which includes drugs like heroin and cocaine, to Schedule III, less addictive drugs like Tylenol with codeine, making it suitable for prescribed medical treatment. Katz calls that a game changer for those who benefit from THC and want an alternative to addictive painkillers.
We're talking about kids with seizure disorder. We're talking about patients who have neuropathic pain for whatever reason, or pain in general.
Doctors would likely prescribe the THC potency based on a patient's health needs.
Probably tinctures, gummies, soft gels.
Some say a DEA policy change on pot is long overdue.
From what I've seen on my own, I feel like it helps out people.
But a drug treatment counselor told me it'll only encourage the abuse of marijuana, which she says is addictive.
Marijuana is a dangerous drug. I mean, there are people that have psychotic breaks from marijuana.
This DEA reclassification process, which does not decriminalize marijuana, could take months. Also, questions like the cost of a medical marijuana prescription and whether insurance would cover part or all of that prescription are still unanswered. In Little 5 Points, Tom Regan, Channel 2 Action News.